Hi, my name is Janis Slezins. I am board certified neurosurgeon, and today I want to talk about a hemifacial spasm, which is a condition that can significantly affect quality of life. I want to talk about that because we just recently had a patient from Germany who was severely affected by this disease. If you or your loved one is suffering from hemifacial spasm, which is basically twitching in the muscles of the one side of the face, this video will help you to understand the disease better if you or your loved one is affected by involuntary twitching of the muscles of the one side of the face. I will try to explain what it actually is and how it presents and what are the surgical options to provide a long-lasting relief. First of all, what is hemifacial spasm? Hemifacial spasm is a condition where one side of your face experiences involuntary muscle contractions or twitches. These spasms often start around the eye and may spread to the cheek, mouth, causing twitching, blinking, or even pulling sensation. It's not just a cosmetic concern, it can interfere with daily activities like eating, speaking, and even drinking. Hemifacial spasm is typically caused by blood vessel pressing against the facial nerve, which controls the muscles on one side of your face. This nerve, called the seventh cranial nerve, becomes irritated, sending abnormal signals that cause the muscles to contract uncontrollably. In rare cases, other causes like tumors or nerve damage may be involved, which is why throughout evaluation is so important. The good news is hemifacial spasm is treatable, and surgical option can provide a long-lasting relief for the vast majority of the patients. So a few words about the exact patient. Today is Wednesday, and this patient was admitted and operated on Monday, and he was discharged back home with no twisting in his face whatsoever in 2 days after surgery. So, how diagnosis is being established and what are the non-surgical options? If you are experiencing facial twitching, the first step is detailed medical evaluation. As neurosurgeons, we use a combination of your medical history, a physical exam, and imaging studies like MRI to confirm the diagnosis and rule out other causes. For some patients, non-surgical treatments can help manage symptoms. These may include medications to relax the muscles or Botox injections, which temporarily block the nerve signals causing the spasms. While Botox is effective for many, its effects wear off in a few months, requiring repeated treatments. For patients seeking a more permanent solution, surgery is often the best option. And now we will talk about the surgical procedure. So surgical treatment option is called microvascular decompression, which literally means that we need to separate the nerve from the blood vessel, which is causing pressure on that nerve. Microvascular decompression is a gold standard surgery for hemifacial spasm. Under general anesthesia, we make a small incision behind the ear on the affected side. Using advanced microsurgical techniques, we carefully access the facial nerve at the base of the brain. Once we identify the blood vessel causing the compression, we gently move it away and place a small, soft cushion, usually made of materials like Teflon, between the vessel and the nerve to prevent further irritation. Microvascular decompression is a very effective procedure. It relieves completely symptoms for above the 90% of the patients. Surgery is minimally invasive, which means it is friendly for patient, and as example with our patient, which I told you before, the patient was able to be discharged from the hospital in 2 days after surgery, which means surgery is easy to bear. It's not difficult for patient to go through this kind of surgery. The goal of the surgery is provide lasting relief without affecting the function of the facial nerve, so you can move your face naturally. And this also means you do not require to use any kind of medication anymore. You feel completely well and you are living your normal life without taking any kind of medication whatsoever. Surely, as every surgery or microvascular decompression also carries some kind of risks, and I want to mention them as well. Like any surgery, microvascular decompression carries risks, including infection, bleeding, or in rare cases, hearing loss or facial weakness. However, these complications are uncommon when the procedure is performed by an experienced neurosurgical team. We'll discuss all the potential risks with you beforehand to ensure you are fully informed. As with our example patient, recovery usually takes 1 to 2 days hospital stay, and you can return to your normal activities within couple of weeks after surgery. And as I mentioned before, you don't need a specific medication to treat your hemifacial spasm whatsoever. Surely there can be some mild to moderate pain at the surgical site for a couple of days, but this can be easily managed with painkillers. If you or your loved one is suffering from hemifacial spasm, you need to know that this disease can be effectively treated. We are accepting patients from abroad for consultations and surgical treatment. So if you are willing to explore this route, please follow the link in description of this video. Otherwise, thanks for watching. Hopefully this provided you some clarity and additional information. Please subscribe to our channel. Please hit the like button and ask your questions in the comment section. I will try to answer them as soon as I can.